openness there to discuss possible other routes?
A significant part of WHO's response to health emergencies in Uganda, DRC, Gaza, Sudan, and elsewhere is supported by funding from the United States. As we have said, we regret the announcement that the United States intends to withdraw from WHO, and we would welcome the opportunity to engage in constructive dialogue. There are also actions that the US government is taking that are unrelated to its intended withdrawal from WHO, but which we're concerned are having a serious impact on global health.
Occur. And I also had to follow up on the question on Argentina.
For example, the suspension of funding to PEPFAR, the President's emergency plan for AIDS relief, caused an immediate stop to HIV treatment, testing, and prevention services in the 50 countries that PEPFAR supports based on bilateral agreements. Although a waiver has been granted for life-saving services, it does not include prevention services for some of the most at-risk groups.
Seen any of that money or any technical cooperation from the US happening?
Despite the waiver, clinics are shuttered and health workers have been put on leave. WHO is gathering data on service disruptions and supporting countries with mitigation measures, including by filling gaps in supplies of antiretrovirals. The sudden suspension of US funding and the sudden disengagement of US institutions is also affecting the response to global efforts to eradicate polio and the response to mpox epidemics in Africa.
Influenza, as I understand it, Maria Van Kerkhove said that seasonal flu data isn't being
In Myanmar, almost 60,000 people, most of them women and children, have been left with no access to life-saving services. And we have limited information about the spread of avian influenza among dairy cattle in the US or human cases. We ask the US to consider continuing its funding at least until solutions can be found.
Second is, if you could tell us a little bit more on a potential creative endowment.
We hope that this exchange resumes soon. We are continuing to reach out to our colleagues in the U.S. government agencies. We haven't heard back from them, but we will continue to reach out, and we hope, again, that that exchange resumes. I want to reiterate that the U.S. has reported human cases of avian influenza through IHR. That has continued. And we do hope that there will be more uploads to the different websites and through the different portals related to influenza, as well as other diseases. So it's not just influenza, obviously, that we're concerned about, but all of them.
Information that you're trying to ask U.S.
Meaning we're asking exactly the same thing. We're asking share the burden, and the U.S. is saying share the burden, so there is no difference at all. And we started this seven years ago. And if there are other issues they raise, we are building a transparent organization, an accountable organization, a responsive organization, and we would respond to any queries or issues there are, and we hope U.S. will reconsider and work with us to continue the reform that we have started seven years ago.
Get back to the table. So I want to hear if you could respond to that critique and also say kind of what